So today I'm here with Rosalba Gutierrez. She is an internationally board certified lactation consultant. She is the head of our group clinic here at Kidstown Dental. She trains and mentors IBCLCs throughout the greater Houston area and is phenomenal. And I asked Rosalba to make a little video with me because I thought it was important that we talk about why we recommend a mom and baby see a lactation consultant prior to coming in if they suspect there's a tongue or lip tie, or just if they're having breastfeeding problems in general. We have a lot of moms who just post a picture on Facebook and their friends tell them it's a tongue or lip tie, and so they want to come in and get it done right away. But we find that the best success is going to happen if they have a visit with a lactation consultant. So I guess the question is, Rosalba, why should a mom see a lactation consultant prior to coming in, and what would be the goals of the lactation consultant prior to sending them here, and what should be accomplished before they just show up for surgery, even if they're coming to the group and you're going to be here?
Well, I think that information prior to coming to visit with you, or to come and check if the baby has a tie, is particularly important on the breastfed baby, because there can be lots of different things that can also be affecting the difficulties that moms are having. So mom might have decided, or maybe a friend told her, that she might have a tie and needs to be checked. But by visiting a lactation consultant, she's gonna find that, yeah, it's possibly a tie that is creating some of the problems, but there are other problems as well that need to be worked in conjunction with the tie.
Okay.
So it's not just a tie always that causes the problems, and that's where I think the lactation consultant visit will help identify what those problems are. And
so what are some of the other problems? And I think that's a good point that you make, because we are in a culture right now where if people think there's a tongue tie or a tongue and a lip tie, they think, oh, I know what the solution is, let me just go get it cut,
right,
and everything's gonna be better. What are some of the things that might be in conjunction that you'd be looking at?
Well, it could be that the baby has a particular difficulty in their position because they have strains in their body, or tensions in their body, or torques in their body.
Okay.
They can have a side preference on their head because of the way they're laying in utero. Okay. They might have already some problems with what we call positional plesiocephaly, and all of that is affecting not only the way the baby's feeding and why they are having pain, but it's also going to hinder the results of the release if that is not addressed simultaneously.
So what do you do for those babies prior to sending them for surgery?
Well, the first thing obviously is going to be to identify that those problems are existent, and then explain to the parents why those things are present,
okay,
and how start moving from that point. And it's going to be definitely addressing the role of the body work. Okay. Refer them to somebody, depending, can be a chiropractor, can be an osteopath. But one of the things I do with a great majority of my babies from the first time they come to see me is address the lifestyle container, and that means talk to them of the dangers, if you will, of what happens when the babies are on a rock and play, when they are swaddled very heavy, when they are on a swing all day, in other words, when they are never on their tummy. Right. So one of my jobs is to address tummy time, and not just tummy time and okay, put the baby on their tummy and whatever happens and 1 second and he's out, but rather address tummy time as a method to help the baby prepare for the release.
Yes, so you, Rosalba, was actually trained in what's called therapeutic tummy time method. And so that's a little different than just putting baby on the tummy, and it's
right,
actually important for neurological integration, which a
correct,
lot of parents don't know that. So
correct,
I think that's fantastic when the babies have that solid foundation before coming. It's like doing their own body work at home, sort of.
Yes, I mean, it's like doing a body work to a certain degree, but it's also helping maintain the work of the body worker from session to session.
Yes, exactly.
Because if the babies go to a body work session and then go back to their lifestyle, which is car seats and rock and plays and never been on their tummy, when they return to another session, the babies will be exactly where they were.
Gotcha.
So by doing tummy time, we kind of extend the benefit of the bodywork session.
So another thing, Rosalba, is that a lot of times when the moms come to me, I'll either see babies that are really undernourished because the moms really want to breastfeed, but
Right.
maybe they don't realize even though the baby's nursing all day, they're not well fed. Sometimes their supply is tanking,
Right.
and they don't know why that's happening. So can you talk a little bit about what are your goals for mom and baby before they come for the surgery? What kind of things are you trying to really put in place so they have a good result?
I think the first and foremost is to understand what are the goals of the mother, of course. If the mother her goal is to be, to breastfeed to the best of her abilities in terms of duration and volume, meaning full breastfeed or complement the feed if mom doesn't have the milk, will be, to do what we call in our profession lactation management.
Okay.
And the lactation management, really talks about everything we do, which means evaluate her milk volume, evaluate latch, evaluate pain on the breast and why there is pain, help her correct the problem that she has in the nipple by giving her a complete healing protocol so she stops having this horrendous pain. And then make sure that the baby is transferring. Introduce supplementation if the baby is not gaining enough.
Okay.
If the mother's milk, like you pointed out, is beginning to tank, which commonly happens because of the lack of proper removal, then we need to instruct mother on what to do about that. And that's what we call lactation management, and it really is just a comprehensive approach. And a lot of the times, moms might think that the baby is latching okay, without realizing that the mechanic and the activity of the baby at the breast is actually not adequate for stimulation.
Gotcha.
So we are able to look at that. We are able to give moms a plan that is workable for them. A mom can come and say, all I do is feed my baby. I sit in the chair at 8 in the morning and I'm still sitting in that chair at 8 at night.
Yeah.
Because I feed the baby non-stop. The minute I stop feeding the baby and try to put the baby down, he will scream, so I go back to the breast. So I give them a plan that opens the possibility of doing not just a proper feed, because now we are going to identify what is happening, but how to feed him in a way that is sustainable.
Yes.
So feed for how long? And then after this long, you might need to supplement if we are missing sustenance. And then you are probably gonna have to pump because probably the milk already has suffered. So that's what I call breastfeeding management, is address everything, not just from the perspective of the latch, but everything she needs lactation-wise to be able to move forward. And
Okay.
the same with the baby.
So to keep the video short, Rosalba is a wealth of knowledge. I'm just going to summarize. It sounds like the things that are ideal and why you'd see a lactation consultant prior to considering going to an office, any office for surgery, would be to make sure the baby's getting adequate neurological integration, tummy time, and just sort of counseling on what's healthy for the baby.
Right.
As far as containers. Troubleshooting if there's any body work that needs to happen and guiding families to get that done, which is really important. Protecting mom's milk supply if she wants to breastfeed, making sure she's got the right volume, and if she doesn't, what can be done for that. Making sure the baby's healthy and well fed. And I think you didn't mention it, but Rosalba also will, if she sees a tongue or lip tie, give some preoperative work to do that helps the baby to have a really awesome
Right.
visit and
That
outcome.
we didn't get to that
Yes,
point.
but that's okay.
Yeah, but what I want to say is that if in the course of my exam I identify the tongue to be the primary concern, and my recommendation will be for that baby to be treated for that restriction, then I will provide very targeted specific exercises for two reasons. Number one, I think it's very important for babies to get used to have work done inside their mouth. It's very important for mothers to feel comfortable putting their fingers inside the baby's mouth and feel what they need to learn to feel. And then prepare the tissues.
Yes.
Because that will facilitate your work.
Exactly.
And you have seen that. When we prepare the tissues with very targeted exercises, then your work is
It makes my job easy.
It's
and
a lot
makes me look
easier.
like a rock star.
Yes.
Well, thank you. So hopefully we'll be able to make some more videos about specific stuff, but we're hoping this helps moms and encourages you to have at least one visit with a lactation consultant. I'd definitely make sure that it's someone that's used to working with tongue ties and you want to ask them that. And get a really good first visit in before you make a trip to someone's office to have a tongue tie or lip tie addressed. Thank you very much for watching.